Doing okay, thank you. All right. You guys ready to kick this off? All right, well, welcome everyone. Thank you for coming this morning. Yesterday we put out a press release notifying the public that we had a child here in Douglas County that passed away this week following a suspected infection with Naegleria fowleri, which is a single-cell organism that causes primary amoebic meningoencephalitis. This child was suspected of contracting this while swimming in the Elkhorn River near Valley, Nebraska. And I wanted to, before we get too far into it, I really wanted to express our heartfelt condolences to this family who's lost their child. This is, while a very rare type of event, it's quite tragic, and we just want to make sure that the family knows that our thoughts are with them. Right now, the CDC is in possession of tests to further confirm that this was indeed caused by Naegleria fowleri. And right now, we are urging the public to simply be aware and to take precautions when they are being exposed to any warm freshwater sources out in public. So lakes, streams, ponds, those types of sources are really where you're going to see your highest risk. Naegleria fowleri is present in a lot of different freshwater sources, so it is not necessarily in one location. It's an organism that can be found in many areas, so there is always a small risk. Things that you can do to protect yourself against a potential infection like this is to plug your nose if you're planning to go underwater, to make sure that you are not engaging in activities that is causing forceful water up the nose, such as water skiing, high-speed tubing, those sorts of activities. And just to be aware that this is something that is now present here in our water, and we need to be aware. Typically, what you will see with this particular organism is that it takes, if a person does become infected with this, it takes between 1 and 12 days for symptoms to start. And usually it's about an average of 5 days that you'll see people start to have symptoms with this. And the symptoms usually start somewhat generalized with a headache, nausea, vomiting, confusion, and typically then proceeds to stiff neck, confusion, and seizures. And in 97% of cases where this has occurred, it has resulted in death. Typically, the time from when symptoms start and death occurs is about 5 days, so it is a very fast-moving infection. I want to stress that this is rare. There have been about 154 individuals since 1965 that have been identified with this particular infection. 4 of those individuals have survived that infection, so that's a very small handful of people. So we want to make sure that we keep it in perspective, but want to just be very open and transparent so that people understand that this is a risk that is here in our freshwater sources in Douglas County. Right now, there is no recommendation to test our water sources. Typically, that because this is a common organism in the water, you're going to find it if you do testing. So we're not planning to do any testing at this time of the water sources. And other than that, I will go ahead and take any questions that you might have. Yes?
Hi, Isabella Basco with Channel 3. One question we're wondering, an Iowa person died about 3 weeks ago from this amoeba. I know you said it was about 154, but are these cases somehow related, and has it usually been rare, or is it becoming more common, and do you find it's multiplying for some reason?
Great question. So it is rare. It continues to be rare. We do see a case here and there from time to time. It could be that these are just clustered in time. They're not necessarily related. The Iowa case had a very specific water exposure in, I believe, Missouri. Is that right? Or is it a Missouri? In Iowa? Okay. There was a very specific exposure there. This case also had a very specific exposure here in Douglas County. What you're seeing is that this organism is present in water. That said, we used to see this typically more in the southern states, and we have seen a trend where it is moving north. So we haven't necessarily seen it this far north before. This is, of course, the first case that we've identified here in Nebraska, and that's really due to the fact that our regions are becoming warmer. We're having drought conditions more frequently, and this organism really loves heat and moisture. So as things warm up, the water warms up, and water levels drop because of drought. You see that this organism is a lot happier and more typically grows in those situations. When it's hot out, you also have a lot of people who are going outdoors to recreate and cool off. So you can also see more people interacting with water sources when those situations or when the environment is ripe for that organism to be present.
Does it affect children more than adults, or is there any age or culture sort of a type of person that is more likely to affect than others?
I haven't seen that there's any specific risk factor, in a child more so than in an adult. I don't know that we've had enough cases to really bear that out.
Can you tell us more about the child, maybe if they were a boy or a girl, how old they were?
I appreciate the question. To protect the identity of the patient and their family at this time, we're not releasing any other details about the child other than it was a child.
Can you say, were they taken to a hospital?
They were, and in fact, I have with us today the physician who treated and our pediatric infectious disease specialist, who's also our medical consultant, who can talk a little bit more generally about that, but we're not releasing any specifics about the child.
Would you
Sorry.
do you mind explaining how, if this organism is common in fresh water, but the risk remains low?
Yeah, so, when water, again, it depends really on the water source and how the water source is behaving. So if you have high water table, it's cooler in the water, you're probably going to have less organisms. As you get that water table that drops, or the water level in a body of water drops, and that, when it's really hot out, we're not getting a lot of rain and things like that, that water source heats up. So if you think about, if you've ever gone to the river, it's cooler kind of in the middle where the water is moving and changing, but when you have like the pools over to the side, they tend to warm up more because they're shallow, they're stagnant, they're not moving as much. So those types of areas, then you start to see more growth. So the risk would go up in areas like that and remain relatively low overall. And of course, there's dilution. So the more water you have, the more that it's going to dilute basically the organisms that are present, and there's less chance for exposure. So, and it does take, I think, more than, a casual exposure. We're talking about that forceful, if you're swimming, if you're diving, if you're, tubing behind a boat, water skiing, those types of activities make that go up. If you're just sitting in an inner tube floating down the river, kind of not putting your face in the water in a forceful way, that risk level is going to go much lower.
Is there anything you can do if you get a water source up your head? Can you rinse out with peroxide or something like that?
I don't know that that's something that has been done or explored or recommended. It's certainly not something that is currently recommended as a preventive. It's, right now for prevention, it's really knowing that the risk is there, plugging your nose, wearing nose plugs if you're maybe doing some of those activities, and just ensuring that you're not getting water up the face.
So the Elkhorn's a popular floating tubing river, and a number of people will be wanting to know, is it safe to tube there? Is it safe to swim there? And you've said that this is a common organism, but now we do have these two cases in our geographic region. Can you tell the people who want to know, whose businesses depend on the Elkhorn also, more about what happened in this case that may have given this individual this illness? Specifically, do you know where they were confined to a beach and just swimming in a shallow area? Or do you know if they were tubing down a river, or where they jumped down a rope swing? Can you help the public who uses this river quite frequently and some whose businesses depend upon it, more information so they can make better educated decisions?
Great question. My understanding is that the individual was swimming in more of a shallow area. I don't think anybody was tubing in this particular incident. In terms of the businesses that do, run tubing businesses along the Elkhorn River, again, we just want people to be aware that this is something that's out there, and your typical tubing activities should remain low risk. If you're simply putting your feet in the water or floating down, even casual swimming can be okay. It's really that facial, getting water up the nose that we need to be careful about. So typically, floating down the river probably isn't going to be a huge risk. You can't get this organism by ingesting it. So, drinking water, if you accidentally swallow some water, isn't necessarily a big risk. It's, again, that forceful water that's going up the
To the
face.
best of your knowledge, just want to follow up, to the best of your knowledge, all this person was doing was swimming. This person wasn't jumping off a rope swing and water rushing up their nose. I think people really want a better understanding of what
Sure.
happened.
So my understanding is that it was typical swimming activity. It wasn't there. I haven't heard anything about a rope swing or any
Like no
other.
water rushing up a nose,
Right.
swimming
Just
in a
the
shallow area.
swimming. Possibly roughhousing in the water. Typical kid swimming behavior.
So basically, when this happened, like, I know we don't know if this person had the forcible ingestion of water, which is swimming roughhousing, but for the most part, would you say if you're swimming, as long as it's not forcible activity, you should be fine?
Again, I would be cautious about any kind of, swimming can be forceful, and if you're in a river and you have moving water, that increases force. So there are other factors you want to be careful of. I think it's a great idea to make sure that you are, if you are going to submerge, to plug your nose or wear nose plugs or have some kind of protective measure in place for that.
You've covered the nose and the mouth. What about the ears? The water gets in your ear.
I don't believe I don't believe that's been a source of entry for any of the cases that we've seen. Is that right, experts?
To follow up on Nancy's question, Iowa officials shut down the site where the person contracted this in Iowa. Are there any plans? Are you guys considering shutting down any sites along the Elkhorn River here?
We are not at this time, and that is a good question. And I know that Iowa had some specific reasons for doing their closure. We did discuss what the appropriate action would be in this case, and we are not planning to shut down. It's a little difficult to shut down a river, and I know that there are, multiple swim beaches and things like that. But at this time, we're not planning to shut anything down. We just want people to be aware of that there is a risk there, even a small one.
What does a small risk mean? What is that?
Well, you're not going to see probably large numbers of people who are contracting this organism from being in the water necessarily, but it's not to say that there is no risk to this happening. Clearly, it's happened here, so that tells us that we know that there is a risk. This also happens in southern states and has been happening a lot longer in southern states. You don't see large numbers of people who have freshwater exposures that are now suffering from this amoebic infection. So we know it's something that remains rare but can happen here.
To elaborate on that a little bit, was this child playing with other children in the area? Were there other people that might have been exposed and just didn't contract it, much like you can be around people with COVID and not contract it? Is it a similar thing?
It's very possible that other people who were swimming in the area could have come in contact with this type of amoeba and not been infected. This was just a very, very unfortunate incident.
With what we know about what what this organism thrives in, like you said, high heat, high moisture sort of situations, and you said that this region is starting to experience those sort of conditions, is this something that needs to be on the health department's radar more in the future?
This particular organism?
And the infection along with it?
Absolutely. I mean, it's something that we now know. We've had a case. It's something that will be on our radar, much like the hundreds of other communicable and infectious diseases that we keep an eye out for every day.
So I'm just trying to imagine what it's like to be somebody who tubes or skis routinely in a Nebraska lake. You're saying that this organism has been here all along?
Not necessarily. I mean, we don't know that. We don't know that. This is the, we don't specifically go out looking for organisms. I mean, there are millions and millions of different organisms that live in water sources. We don't necessarily go out regularly just looking. We know that this has occurred. So, and there are no other potential exposures identified. So now we know it is here.
I want to clarify then, I thought maybe earlier you'd said that this was a commonly occurring organism in water, but you meant to say, or you did say perhaps southern waters. And so it is a new organism to our waters, is that what you're saying?
Possibly. It's impossible to say how long it's been here. We have no data to inform that.
Can you talk about how it got here?
Actually, I think Dr. Neiman may have a comment on that. Do you want to come up?
Hi, Dr. Carrie Neiman. So this organism probably is present in most fresh water, and it lives in different stages. And for the most part, it lives in a cyst stage when the water is nice and cold. Once the water gets about mid-80s, then it transforms into what we call a trophozoite stage. And in that stage is when it can then cause the infection. And what happens is that forceful water or mud, because it can live in mud as well, goes up the nose. It has entry through the olfactory nerve, so our smell nerve, and then it can go from there to our brain, causing the meningoencephalitis. And so for individuals who are out boating or skiing in the middle of a lake, that water, like Dr. Hughes said, is going to be a lot colder just because of the depth. But if someone is splashing around shallowly where that water is really warm, that's where that risk is going to be increased. And one of the reasons we don't look at all the different waters to see if we can find this is because we think it's there. And to give you sort of a risk, one number that I've seen as a statistic is that there's probably about 2.6 cases for every million exposure opportunities. So every time someone has one of those, fresh water into the nose. But nationally, there is anywhere from 0 to 8 cases of this a year. Traditionally, it has been in the southern states, but as we're warming, we're now seeing it. We've seen it in Minnesota, though, as well, even northerner.
So I kind of hear you saying that we think it's been here we think it's been here,
It's
but
been
what's
here.
happening is the water's getting warmer, so it's activating to that other
Yes.
stage more often.
Yes.
Or at least it has in Nebraska.
Has the
Iowa.
potential to, yeah.
And I want to make sure you're describing it's because of these drought-like conditions we're experiencing.
Yeah, drought-like, and then, the lower water table, and then the higher heats. And so when you look at what time of year that patients get this, it's going to be usually in the summer months, with July and August the highest incidence across the U.S.
There's no threat to drinking water, right?
No, the drinking water should be, as long as it's chlorinated and it's been maintained, it should be completely fine.
Could I get a pronunciation of the organism itself, how to say that name?
Naegleria fowleri.
And then, I know you said your name, but could you just spell it out and give your job title too?
Oh, sure. Carrie, K-A-R-I, Neiman, N-E-E-M-A-N-N. I am a pediatric infectious disease physician at Children's and a UNMC, and then the medical advisor for Douglas County.
I'm wondering if you could speak about meltifazine. An expert at Nebraska Medicine said this is something a medication that they pre-stationed that could potentially help somebody, because we keep hearing that there's a nearly uniform death rate, but is that a medication that could potentially help somebody, and is it widely available?
It could potentially help. Now, we don't know what the best treatment for this is, because there's not been a lot of cases, like Dr. Hughes said. There's been about 154 since we started recognizing this, so no randomized control trials to to let us know. So we go off of what things have worked in the past, and so with those 4 patients, it's usually been a cocktail of drugs, usually about 5 different therapies, of which methylphosine is one of them. That used to be a drug that the CDC housed, but now it is available commercially.
The fact that it's so rare, is that one of the reasons why it has such a high death rate? There hasn't been the research involved, and maybe the pharmaceuticals haven't had any attention on this? Is that one of the reasons for the high death rate?
I think it's very rapidly progressive illness, and it presents very much like a bacterial meningitis, and practitioners are going to initially focus on that, and when our initial tests are not showing that, then and we put that together with an exposure history, then we think about this entity and look for that.
I'm wondering if you could talk more about the child who was taken to a hospital, or what kind of treatment was done to try to help them?
A child who would present with signs that are concerning for meningitis or encephalitis, as Dr. Hughes said, would present with fever, a lot of times nausea, vomiting, confusion, maybe seizures, obtundation. We would generally perform a lumbar puncture on them to evaluate their spinal fluid to see if we can see if there's evidence of infection there, looking at white blood cells and looking to see if we see any bacteria. We would start them immediately on broad spectrum antibiotics targeting the most common causes of meningitis for their particular age. But we will continue to broaden what we call our differential if we're not rapidly coming up with an answer, and that's exactly what happened here.
Okay, so what you just described is what the child underwent in this case?
This is what any child presenting with meningitis would undergo.
So does that mean that's what this child
Yes.
underwent? Okay, thank you.
Okay.
Any other questions?
Would it be, this might be outside your field, but do you have any sense whether this is an eastern Nebraska thing, or whether this might be an issue for people going to Lake McConaughey or something like that?
I think this is an issue for any body of water that is getting warm.
Sorry, you might have said this already, but at what point did the child go to the hospital? And at what point should a child go to the hospital if they're experiencing these symptoms?
I believe this child began having symptoms about 5 days after exposure, which, as Dr. Hughes said, is just about classic. And the child was in the hospital within, I believe, 48 hours of onset of symptoms.
Are the symptoms so specific that you could diagnose that right away, or a child comes in sick with fever and all these symptoms, and this is so rare? What would make you think that this was, the cause in the first place?
It's the constellation of symptoms of fever, headache, nausea, vomiting that all suggests that there's an intracranial process going on with the onset of seizures, or sometimes with this illness there could be hallucinations or changes in smell that might clue you a little bit into Naegleria. But we have a low threshold, knowing the high mortality associated with any type of meningitis, to evaluate these patients very closely.
I apologize for this question. The child showed symptoms 5 days after being at the Elkhorn, it sounds like, and then was hospitalized 48 hours later. Could you please tell us at what point the child passed? Was it a day later? Being hospitalized?
The patient passed away 5 days after symptom onset.
So they 5 days after they went swimming, they got symptoms were, so about 10 days after exposure.
Yep. Yep.
And I apologize.
That's right.
Are there any other questions that we can answer for you today? And I apologize, I am not as good at this as my PIO, so. I did have one correction, though, that I wanted to issue to all of you from the press release that went out yesterday that most of you received. On there, it had indicated that this was possibly acquired while swimming on Sunday. Actually, that exposure, that swimming happened on the 8th of August. And then symptoms began about 5 days after that. So I apologize for that error and just wanted to make sure you had that correction.
So it happened on the 8th of August, and what'd you say after that, symptoms?
Symptoms started 5 days after that exposure.
So the child died the 18th.
I believe it was the 16th. Is that right? 17th. Sorry, I'm not looking at a calendar.
We don't like to ask these questions.
We don't like answering them. This is a very hard one. Okay.
Are you hearing any updates on COVID or monkeypox?
Oh my gosh. Oh my gosh. COVID is alive and well. Our rates are decreasing. We've moved into the medium risk category, I believe, so that's a good sign. Acuity in terms of people being hospitalized or being on ventilators has been pretty low, so we're happy about that. Monkeypox also alive and well. I will just say we're up to 14 cases right now. We are working with all of those cases to identify contacts. We are also offering vaccination to high-risk individuals in our community. We're keeping a very close eye on how this behaves and who has it here, and working to prevent further spread, and we'll keep on doing that. Justin, do you have anything you wanted to add?
No, unless you have more questions. Just your comment on the new CDC guidelines. I asked this because I talked to one other local doctor who disagreed with them.
The new CDC guidelines in terms of COVID.
Rolling back some of the precautions.
I think it's a hard thing to balance, and we are looking at what the public needs and what the behaviors are going to be in the public, and what we need to do for prevention, and trying to kind of walk a line there. And I think the CDC is trying to do that. The CDC certainly issues their recommendations based on what they're seeing throughout the entire country, not just in one locale. So, it's really up to us to kind of watch and see what's happening and make recommendations based on what's happening. Do I agree with it? It is what it is. It's what they've decided that they want to put out. I think that we still need to understand that it's in our community, and we need to take measures to protect ourselves when we know there's more of it circulating in our community. So continuing to isolate when you're not feeling well. Stay home when you're sick. Don't go to work when you're sick. Don't go to school when you're sick. Testing to see if that's what you have, so that you know how to act and prevent others from getting sick. Making sure that you are wearing a mask, especially if you're high risk, when you're in public areas, especially if you don't know the vaccination status of the people around you. Making sure you get those shots, and those are absolutely still available. So if you haven't gotten your series yet, we're very happy to help you get that. Boosters are also still available, and happy to help you get that as well. So that's really going to be key to making sure that our rates here remain low.
A follow-up to that, the CDC dialed back on what happens in exposures. How is the health department working with school districts before the start of the school year, or start of the school year?
Sure. Good question. So in terms of working with the schools, we are just making sure that they have the correct guidelines or the most updated CDC guidelines. We are asking them to adhere to that, but these are recommendations. And again, however the school districts, opt to work that out for how it works in their districts, that's really up to them and their call, and we are here to support them however they need it. If they're identifying sick teachers or children within their school systems, if they feel like they're having an outbreak or clusters, we're here to help them however that looks.
What does that mean, help them?
It's going to be different depending on what that school district is doing. So it's hard to answer that because it's really going to be based on what's happening at the time.
This is probably addressed earlier. I'm new to this topic of amoeba, but the child is a Douglas County child, and the exposure was in Douglas County. Is that correct?
Correct. It was a Douglas County child, and the exposure happened in Douglas County. Yep. I can take one more question since this wasn't technically a COVID or monkeypox press release, but I like y'all. I'll take one more if you have one more, and if not, that's fine too. All right. Thank you guys so much for being here. Do any of you have anything else that you want to add?
I would just add one thing.
Great.
The National Water Information System, if you can actually go to their website, they measure temperature in Waterloo, Nebraska, which is about 3 to 5 miles from where the potential exposure happened. And during that week, the water was measuring between 86 and 92 degrees. And Dr. Neiman commented on how this particular amoeba likes those warm waters. And so again, with drought conditions and warm temperature, we had an exposure. So I just wanted to point that out, that not every body of water is going to be that warm. But Nebraska, we are currently seeing a drought. And you know, hundreds of millions of people swim every year, like Dr. Hughes said. And this is still a very rare occurrence, but we just ask that people be aware and take the proper precautions. So that's all I have.
When the CDC test will get back.
I do not know. Hopefully next week.
Could you repeat that website? Sorry.
Yeah, it's the National Water Information System.
And you need to say who you are.
And my name is Justin Frederick. Last name's Frederick. I supervise our infectious disease group, or Office of Infectious Disease. Douglas County Health Department. Thank you.
All right. Thank you, everyone. Thank you. Do I need